finally got a hold of my mom. She can talk to you more about MUJO and how well it's worked for her osteoarthritic pain and also sciatic pain.
Yes,
and, sci-
sciatica.
and sciatica. Here she is.
Hello, everyone. Um, the MUJO ointment works speedily. That's the first thing. It takes about 8 minutes after applying it, and you start feeling relief, and it lasts at least 12-15 hours. I've gotten such relief from it. It's a wonderful product. And if you just make sure to let it dry before you cover it up, so it soaks into the skin. It really gets to my sciatica and my osteoarthritis.
Thanks, Mom. And also, you want to tell them how you use it? Like, you use the cream and then the roll-on?
Yes. First you massage the cream in. Wait a little bit to get a little dry. And then you massage, you put the roll on, and it's so nice. You just roll it in and let it dry.
So there you Welcome to Proven Cures. If this is your first time here, my name is Sarah McLeod. I am your host. I am a medical writer and clinical research specialist. And I started this video with a testimonial from my dear mom because it is so pivotal as a basic honest introduction to these two products that I totally stand behind and that are sponsoring this video. This is going to be a 3-part series that I'm doing for a company called MUJO. These are excellent products, as my mom mentioned, and she's an honest person also. And also, the reason why I really wanted her to do the testimonial part as opposed to myself is because she has serious chronic osteoarthritis and she suffers from sciatica. Serious chronic pain that's been on her for all of my life, over 40 years. And she's an octogenarian. She's a spunky person. She's somebody who's very active. She'll hop in an Uber before waiting for me to take her someplace. She just seemed like the perfect person to give an honest testimonial as to alleviation of pain from topical use of a pain relieving cream, an analgesic cream. And it's so novel because even if you visit a pain treatment center or somewhere like that, you will, 9 times out of 10 be introduced to oral therapy, drugs that have to meet with your kidneys and your liver, drugs that have to pass through your gastrointestinal system, and their efficacy is dependent on bioavailability in the gastric system. But with topical application, it's kind of iffy. Like, we've always had stuff on the market like Bengay, but let's be honest, guys, like, sorry, I have a hair in my face. Let's be honest, with things like Bengay, you will get very temporary relief from muscle soreness, but that's about it. You still are going to find, especially if you have serious chronic pain, you're still going to find a need to take some form of oral NSAID, ibuprofen, Tylenol, something like that, or even something stronger depending on your pain severity. And what my mom was saying, she has serious pain. I really wanted someone who's a real sufferer to evaluate this medication. In addition to her evaluation, however, this is a channel that is dedicated to clinical research trials. I did my own research. So here goes. In reading the ingredients on both of these packages, we have a list of ingredients at the bottom, a big list, with names that I automatically recognize over time as being attributable to pain alleviation. And so I did a PubMed search for clinical trials using some of these herbs in topical form to see how well they did to alleviate both osteoarthritic pain and muscle soreness in different populations. So of the I'm not going to read off all the ingredients that I have here that are on the box because that's laborious, but I am going to read off the ingredients for which I was able to find applicable clinical trials. And these ingredients include glucosamine chondroitin, boswellia. I'm trying to find the whole name here. It's very small print, guys, so bear with me for a second. Where's the boswellia? I know I saw boswellia, unless this is the wrong. Okay, hold on. Yeah, boswellia serrata extract, which is a scientific name for frankincense, and also organic Arnica montana flower extract. So I found 3 separate studies. So that's why this is going to be divided into 3 separate videos. So this first video is going to be dedicated to the mechanism of glucosamine sulfate specifically. While working synergistically with chondroitin sulfate and camphor, which is listed on both of these as the active ingredient for osteoarthritis of the knee. Okay, I'm very excited to share this data because it's few and far between. It's hard to find clinical trial data of herbal supplements, and it's even harder to find clinical trial data of topically applied herbal supplements. And I found some good stuff here, guys. So let's dive in. The first trial we have is titled A Randomized Double-Blind Placebo-Controlled Trial of a Topical Cream Containing Topical Cream. And I'm going to open the this is what it looks like. Okay. You can see it says Muscle and Joint Pain Relief Cream. Alright, so this evaluates a similar cream which also contains glucosamine sulfate, chondroitin sulfate, and camphor for osteoarthritis of the knee. It was published March of 2003 in the Journal of Rheumatology. Researchers sought to assess the ability of a topical preparation of glucosamine sulfate and chondroitin sulfate to reduce pain related to osteoarthritis of the knee. 63 patients were randomized to receive either the topical glucosamine and chondroitin preparation or a placebo to be used over a period of 8 weeks. Efficacy, meaning did it work, was assessed using a visual analog scale for pain, in addition to something called WOMAC, which is the Western Ontario and McMaster University's Osteoarthritis Index, and the SF36 questionnaire, which is a questionnaire also to evaluate for pain. Alright, so I was lucky enough to find the full text of the study, which is amazing because the full text, the researchers, in order to publish, guys, have to give background information for the agents that they use in the clinical trial. They have to explain basically why did we choose these. I don't like to call them drugs, right? Because they're not pharmaceutical drugs. But if they're being used to treat a condition, they are drugs. Pish posh. But basically, researchers have to explain why they're using these, why they're testing these substances, okay? And so in that background information, when you're able to get the full text for the study, you're able to learn more about the actual ingredients in the cream, in the investigational products. You get to learn more about the ingredients, right? So I'm going to dive into that in greater depth here. So listen up. It's really, really, really very interesting information. I'm going to have to move this around a bit. Guys, it's so hard with my camera and the phone, but whatever. So it says here that glucosamine and chondroitin sulfate have been consistently shown to be agents of low toxicity that may relieve the pain and joint stiffness associated with osteoarthritis. Long-term use of glucosamine has been shown to reduce radiographic progression of osteoarthritis of the knee. Guys, do you understand what they're saying here? They're saying that you're using the glucosamine with the idea of the way it's promoted just to relieve pain. Researchers are saying we've looked at persons who use glucosamine over a period of time for osteoarthritis of the knee, and their osteoarthritis did not worsen. That's what that's saying. And they're attributing the stability of the osteoarthritis to the use of glucosamine chondroitin. This suggests that it may be chondroprotective, a disease-modifying agent in osteoarthritis of the knee. Now, here's the nitty-gritty. So you could be thinking, well, that may be true. However, how was it taken? How did we know that using it topically for my osteoarthritis is going to produce the same results? They dive into that next. They go on to say that although rapidly absorbed from the GI tract, pharmacokinetic data shows that when administered orally, glucosamine is subject to uptake and degradation by the liver and uptake into non-joint tissues. I have to move my camera a bit so I can get all the words off the screen, guys. Yeah, so it's saying that it uptakes into non-joint tissues when taken orally, so that the dose reaching the articular cartilage is only a fraction of a percentage. But while glucosamine has been shown to be active when given intramuscularly, meaning injected directly into the muscle, direct topical application into the dermis, the skin, surrounding an affected joint may potentially deliver a more concentrated dose to the affected area. Chondroitin sulfate has also been shown to be effective in reducing osteoarthritis pain and to enhance the pain-relieving action of glucosamine, which shows these two work synergistically to reduce pain. They enhance chondroitin when added to glucosamine, enhances pain relief despite poor gastrointestinal bioavailability when administered orally. Chondroitin sulfate is believed to act as a carrier substance to enhance dermal penetration, skin penetration, when used topically, as with our cream and our roll-on gel here. All right. So this study examines the use of a topical glucosamine chondroitin sulfate preparation containing camphor and peppermint oil. As with both of these treatments contain these substances: glucosamine chondroitin, camphor, and peppermint oil. So this study is perfectly aligned with what we have here for MUJO. All right. Real quick, the study was performed at a single center as opposed to multiple centers. I already explained it was a randomized double-blind placebo-controlled trial. Quickly, so that you understand, that means, how many persons did I say were enrolled in this study? I think 63 patients. So they're saying that of the 63 patients, half were put in the arm receiving the topical agent, and half were put in the arm given a placebo. That's what randomization means. Just randomized randomly in each arm. and it was double-blinded, meaning neither the patient nor the study administrators knew exactly what the persons were given. So the way they'll do that, they'll have, so if we have 63 patients, we'll have all of our study agents, 63 study agents, and all of them marked differently. They won't blatantly say this is the glucosamine and this is the placebo. They might be marked AB or something like that. And they're just handed out until, willy-nilly to each participant until they're all handed out. That's one way of explaining how it'll be randomized and double-blinded. All right. So let's see. Patients were randomly assigned to use either the topical preparation or the placebo for a period of 8 weeks. I think I just explained how they measured pain. So let's get into the results. Okay. I love how they gave us a little table here, which isn't difficult to read. Here we go. Here we go. So here we go. We have this first table gives us an evaluation of pain at 3 clinic visits. So it's looking at changes from the first to the third visit. And the placebo group consisted of 29 persons, and the active ingredients group consisted of 30 patients. Prior to receiving either placebo or the study drug, all of the patients in each group kind of measured at the same level on the pain scale, with the placebo group having an average pain measurement of 6.2 and the active group having an average pain measurement of 6.1. The drastic difference, however, comes at week 4 on the pain scale, with the placebo group having a decrease in pain from 6.2 to 4.8, and the active ingredient group having a decrease in pain from 6.1 to 3.5. So now you must be thinking to yourself, well, but they were receiving a placebo, so why would they experience any decrease in pain? It would be actually inhumane, guys, to have your study subjects, who are human beings, experiencing pain and they're not allowed to take some form of pain relief. So when you see something like this, without me even diving into the details of the study, which I probably will do again later anyways, but what this says to me is if they're experiencing this kind of inflammation, they're allowed to take an ibuprofen or something of that sort throughout the course of the trial. And the topical creams were given in addition to see if they helped alleviate pain, maybe for a longer period of time. So that is why you see a decrease in pain also in the placebo group. Week 8 now is a real teller. In the placebo group, remember at week 4, pain leveled out to 4.8. At week 8, there wasn't much difference, with pain scale on average measurements being at 4.6 with the placebo group. But with the persons who were taking the topical cream, their pain measurements decreased from 3.5 at week 4 to 2.8 at week 8. Let me see, guys, if I can find proof for what I just said in regards to taking an oral therapy, because I'm basically just speaking from my experience with clinical trials, that you're not going to have a patient group that's suffering and you're going to completely take away all therapy from them. That is unheard of because it's considered an inhumane practice. Okay, so just like I said, it says it right here on page 2. If you pull up the PDF for yourself and you want to go in and read this for yourself, because it's very interesting information, but it corroborates what I said. It says that participants also completed a daily diary at home, which included pain ratings on a self-administered visual analog scale, use of their study medication, use of oral analgesics, right? Like ibuprofen, and occurrence of adverse events. So they were taking something for pain. Just the placebo group showed that reliance on just oral medication was not as effective for pain alleviation over a period of 4 to 8 weeks as when combined with the glucosamine chondroitin topical cream. And that was the conclusion of this study. What I would like to add, however, is that the MUJO creams don't just contain glucosamine and chondroitin. My mom mentioned, I forgot what she said, guys, how long she experienced pain relief from these products, and now like every single time she's in pain, she's reaching. I'm gonna have to buy some just for her, because she's reaching for these twice per day now. Like, yeah, because she likes being on the go. She likes to just do her own thing, always cleaning. She exercises. She's always doing stuff. So she doesn't want pain to hold her back in life. So rather than reaching for the Aleve, and she's also, because she has sciatica, she has degenerative disc disease, she has some other thing that I don't know how to pronounce. She is actually eligible to be on serious pain medication, i.e. Codeine, that kind of thing. Really detrimental, high-level drugs, and she refuses those, and she still touts relief from these topical creams. So that should tell you just how powerful these are. Now, like I said, this study is only looking at glucosamine and chondroitin. So persons, maybe they felt like they had to also have an oral medication with it. My mom uses these without the oral medication. And I think that's because this is so well formulated. It has other ingredients that are also clinically proven for the alleviation of pain. And that is why I'm doing a part 2 and a part 3 to dive into those studies. So yeah, I'm going to leave my link for these products in the description section of this video. Also, I'm going to put on this video my discount code PC20, so you can get 20% off your order. Yeah, because this stuff is the truth, guys. And you know, my channel is a no-nonsense channel. I'm only going to sponsor the real. I'm only going to sponsor what I believe is going to work. And I definitely would not put my 80-something-year-old mom on this channel lying to anybody. That's not my style. Fully Christian to the core. So yeah, I'll look out for parts 2 and 3. And thanks for watching.